Hi, and welcome back to the Mom and Mind podcast for another episode of Behind the Sessions. I'm your host, Dr. Kat. Today, I want to talk about medication, but in a different way. We have had a lot of guests on the show, both professionals and people who have lived experience that have talked about taking medication. And with the professionals who've talked about taking medication, they've done a really great job of talking to us about why medication is taken, under what circumstances, what to consider, the safety of taking a medication, and like really, really necessary information like that, technical information, detailed stuff that you would need to know in order to make a decision about taking a medication. And we've also had a lot of people talking about their personal experience of taking a medication. Some people who were very okay with starting a medication and going through that process of medication trials with their doctor to find the thing that worked best for them. There have been other people who've been really hesitant about taking a medication and talked about, some of their process and the difficulty of making that decision. And other people who have decided to not take medication as an option for their healing and recovery. And whatever your personal stances or your personal beliefs are on taking medication during pregnancy or postpartum, that's fine. That I'm not here to convince you of anything. You want to take them, great. If you don't, great. However, I will say that there are sometimes as a therapist where people don't want to try medication and they put it off and put it off and put it off, or just don't want to, and then decide to take medication and then feel the relief of it and wish they had taken it sooner. And certainly there are other people who don't want to take medication at all, and that's their decision and that's what they stick with. What I want to talk about today is something that happens in therapy around medication, and more specifically, some of the nuances of discussing medication as an option for treatment, and people's process around medication and around considering medication. Now, I'm going to preface this with some things that we've talked about before on other episodes. When we're considering medication at all, if I am, as a psychologist, as the person's therapist, meeting with them, it's a tool in the toolkit. And for people who are having mild symptoms or symptoms that can more easily be managed by shifting around their sleep and making sure they have rest, the proper support. Typically, those aren't the people that I'm suggesting to consider medication. However, there are people who definitely know that medication is what they want and need, even if it's quote unquote mild symptoms. And that's the treatment route that they choose along with therapy. When I'm meeting with people, I give symptom questionnaires. So, like a screening questionnaire of symptoms of depression, of anxiety, of PTSD. I will give the Edinburgh Perinatal Depression Scale so that I can get kind of an objective sense of where the person I'm meeting with, where they see their symptoms and how it's affecting them. And in addition to that, I ask a lot of questions during our sessions, and I'm gauging how somebody's doing. Each time I meet with them, I might be asking specifically, how are you doing? How are you feeling? Has anything changed, gotten better, worse, the same? And I'll be looking for signs of things that they might not necessarily have words for yet, but are expressing in other ways, whether it be physically or emotionally, or they're saying things, phrases that sound like anxiety or sound like depression. So if somebody right away is very clearly, very seriously and severely within their symptoms, depressed or anxious, or dealing with trauma, or experiencing any type of bipolar symptoms, then I'm more readily suggesting that they talk with a psychiatrist, or if it's hard to get into a psychiatrist, first meeting with their general practitioner, because usually they're the first line, easier to get into for the most part. to talk to their providers about medication as an option. And other times, people will come in and I'll meet with them for several weeks, sometimes even several months, and be getting a sense of how their symptoms are unfolding. And if what we're working on in therapy isn't quite cutting it, or their symptoms are such that they're getting in the way of using any of the coping skills or tools that we're working on, then I will suggest that they consider medication as an option. And me as a psychologist, I'm not a prescriber, but part of my role is to keep tabs on symptoms, check in with people, see how they're doing. In part, my other role is to be, in some way, an objective onlooker, an objective person who is tracking how somebody is doing, who's meeting with me. One of the reasons why that is so important is because people who are experiencing anxiety and experiencing depression don't always know that that's what they're dealing with. Certainly, if they don't know what the symptoms of anxiety or depression are, then they wouldn't be able to say, oh, yeah, this is anxiety, or oh, yeah, that's depression, and so on. But more specifically, sometimes these symptoms, mental, emotional, psychological symptoms that people are experiencing, are such that they're happening and building in a way that the person who's experiencing it can't really track so much that they're getting worse, because they're just in it. They're feeling it. They're feeling the symptoms. They might be very in their head about their own process. They could be feeling worse and worse about themselves, but not necessarily clock that that could be part of the depression or anxiety or whatever else is going on. It just feels bad. They're not necessarily saying to themselves, I'm getting worse. This is getting worse. Even if they're having feelings, physiological feelings, emotional feelings that they are feeling worse, it doesn't always translate into kind of a logical, okay, well, I should really check into this. Sometimes it does. But part of the reason why it doesn't always is because people are really trying to just get through the day. They're trying to cope. They're trying to put one foot in front of the other, even if they feel horrible, even if they feel just so terrible. There is a lot of still trying to push through and push forward. So the focus isn't necessarily on, oh, I'm getting so much worse. It's just the focus is on, I got to get through the day and make it through to the evening and then to the next day. And that is a fairly adaptive way of trying to get through things. A lot of moms that I talk with, anyways, are high functioning, meaning that they can still do a lot of their normal day to day things. They can take care of themselves, they can take care of baby, they can do a lot of those task based things that need to get done. But internally, they could be feeling very anxious, very worried, really down on themselves. But because in a lot of ways we've portrayed depression and anxiety in a way that it makes it look like people can't function when they have severe symptoms. But the opposite is actually quite true. You can have severe symptoms and still be functioning. Just as a side note, asterisk, this is one of the reasons why I find some of the way our medical systems are set up to be so problematic, because somebody's capacity to function doesn't always go down with their severity of symptoms. Anyways, that's for another time. So a lot of the conversations I have with moms are me really trying to take a sensitive approach, be considerate of where they are in their process, and not just come right out and say, well, yeah, things aren't improving. You don't sound like you're doing well, so you should consider medication. That's just not helpful. And it's not the full picture. It's also not my style. And when I'm considering bringing up medication as an option more seriously, I might have mentioned it previously that that is always on the table as an option. But if I'm bringing it back up because I have concerned that symptoms are not improving or are worsening, it's really, really important to be sensitive to the fact that the person I'm talking with might not realize that they aren't getting better, or that they're getting worse, or they're at a point kind of in the severity of their symptoms where medication should be considered or could be considered. So, delivering this idea, this thought of medication, for some moms, the response that I get is like if I suggest to them that medication is an option at this point, it is something to consider. What are your thoughts on that? Do you feel like that fits? Do you feel like your symptoms are at a point where, yeah, it is time to consider that, or it is at least worth talking through? Sometimes the response that I see from people is like almost a little bit of defeat. Like, sunken shoulders, sunken head, breath out, bit of sadness, grief, not quite to the level of shock, but certainly that could be in there, whatever a lesser version of shock would be. Because to my point earlier, they might have been really holding on tightly to just getting through the day and not really even wanting to know that things are getting to a point where they're worse or not improving. And, when somebody's considering medication, I don't know all of the history that they have with the idea of taking a medication. I know fairly well, usually, what their perspective is on taking a medication, but they may be having an experience of like, oh, that means I'm really bad, or that means I'm weak and I can't get it together enough to get myself better, or what is my partner going to think? What is my family going to think? Are they going to be supportive? How is it going to affect me? Will I still be able to nurse? Will I still be able to pump? And so they could have a flood of questions coming in about what does this even mean to take a medication, and what is that going to look like? And because societally we've done such a bad job around psychiatric medications, of normalizing them, of understanding their importance and their prevalence, really. Loads of people take medications and are greatly benefited by taking them. We have a different response to psychiatric medication than we do to, let's say, really any other medication, like taking insulin if you are diabetic, or taking migraine medication if you have frequent migraines, or whatever it is, the other condition you have. Yes, people like to think through their options for other medications as well, but there isn't such a stigma to it. It doesn't mean failure all the time for other people. It doesn't mean you're a bad person because you have to take a diabetes medication. It doesn't have that connected to it, but it does for psychiatric medication, which is so unfortunate and actually not at all valid. That it doesn't mean anything about you, who you are, if medication is something that you need or want to take for depression or anxiety or whatever other psychiatric condition you're dealing with. This is a medical condition. But when I'm, meeting with people, they're having to consider all of these things that could be just like running through their head about what it means to take medication. And so there's not always actually, let's try that. Sounds like the right next step. Sometimes there are several sessions where we're considering it, talking through what that means, talking through what the appointment with a psychiatrist would be like, talking through how to bring it up with a partner or a spouse or a family member, talking through my clients' fears and concerns about taking a medication, talking through the potential benefits of taking a medication, and what they can kind of reasonably expect. I don't love that word. and also letting them know the limitations of my degree, of my license. I'm not a psychiatrist, I'm not a medication expert. So there are things that I can't answer, that they would need to talk to a physician or a nurse practitioner or whoever it is that they're getting medication from. We talk through the fact that, having an appointment with a prescribing provider doesn't mean that you immediately have to take medication. What I think is important here is to know that it's okay to have a process, to take your time, unless, of course, you're in an emergency, psychiatric emergency, but to think through these questions that you have and to get answers. Some of what I kind of support people through is understanding too that medication is a tool in the toolbox. It doesn't get rid of everything. It doesn't erase your problems, the things that are the stresses in your life that are contributing to you even having depression and anxiety. It doesn't make those magically go away. The real benefit of medication, at least in the beginning, is to when the medication gets to a therapeutic effect, therapeutic dose in your system, you start to feel the weight lift a little bit. You start to feel like your head is above water, like you can breathe a little more easily, like you can use the skills and tools that we've been trying to employ, but you haven't been able to because the anxiety is so high, you can't break through to get to the skills, or the depression is so low that you don't have the energy or bandwidth to stay with a skill in order to see how it's going to benefit you. So getting your head above water, feeling like you have a little bit more space to breathe and to think and to be, is really where I see the most benefit, the initial benefit the most. And then comes this other relief of, thought processes not going so fast and not just being on repeat all of the time, and being able to see that things are going to be okay. Your body's not working on fight or flight constantly. It is you're able to see like the longer view. You're able to see that, okay, maybe it is possible to feel better. And honestly, these are the parts of the work that I do that I just love. When people feel relief, it's the best. And I'm not talking about just with medication. This is across the board. When people have these, aha moments, or something clicks, or they do feel the benefit of the medication and they're able to see that that suffering that they had is not going to be forever. I can say that all day. I can say it all day that yes, you'll be able to get through this. And I know because I've been through it. I know because I see people get to the other side and be better, feel better. But when you're in it, and it feels so heavy, it's really hard to hold on to the idea that things can and will get better with the right help. So sometimes medication is part of that right help. And I think it's really, really important for us to normalize that there is a process around this, and that it's okay to have these questions about medication. And it's understandable that you might feel that like little defeated feeling when somebody suggests medication is an option, or it's time to consider that with your provider. But what I don't want it to mean for you, for anybody, is that you failed in some way, that this is some sort of life sentence. People aren't always on medication for the rest of their lives. Sometimes they are because, hey, that's what works. But it doesn't always mean that there's nothing wrong with you if medication is what you want and need in order to feel better. That, people around you may or may not understand. And that's not necessarily a reason to choose to not take medication. I say that also knowing that it can be really difficult to live with people who don't support you in your treatment options and what you believe and feel is best for you. Other people's opinions on how you decide to have your healing shouldn't be the final say. I've just seen people suffer for too long because of things like that. And I want to normalize that it could take some time to kind of just to think through it and to be okay with medication as part of your treatment plan. There are things to consider, and for the most part, people that I've met with, if they're going to have side effects on medication, they're relatively mild and they go away, within a week or two, and then people are feeling the benefit of the medication. And when they do have side effects that are not really tolerable, then medication is switched. And if it ends up not working out, any of the medications, then with the support and care of your provider, you wean off of those medications and then you go on about your life. It's just too front loaded, heavily loaded with this idea of failure and all this other horrible stuff. It just doesn't need to be there. It's an option and it can help a lot. And some of the scenarios I'm thinking of mostly when I'm talking about this topic is, these are moms, women who are suffering, who are having depression and anxiety, or one or the other, who don't have adequate support to get the sleep that they need, who don't have adequate support to just even have the rest or self-care that they need. And without being able to get, the rest of the family or the spouse in to therapy and help them understand how to support the mom better. Sometimes the option for getting unstuck is when the symptoms are at this moderate to severe range is starting with medication and getting to a place where you feel like you're improving, or at least the heaviness of that is lifted. And that's not to say that's all of the scenarios. There are plenty of folks who I met with who do have a lot of support and who do get the sleep that they need, and still the symptoms are what they are. So we have to really stop painting depression and anxiety during pregnancy, postpartum, fertility challenges, all of that. We have to stop painting them with such a wide brush. Everybody's experience is different. And so we can't make assumptions about what somebody's needs are based on the kind of support they have or don't, based on the how they're functioning or not. It really is so beneficial for people to be in therapy, to work with a therapist who understands what's going on and who can guide them through and support them through the decision-making process. And I am now specifically talking about medication. Again, knowing full well I'm not the prescriber. I'm only, working with people to understand the emotional part, the psychological part, keeping track of symptoms, noticing with them and checking in with them how they're doing, and is what I'm seeing what they're feeling. Do they agree? Is this a worthwhile step forward? And if not, then it's not. But there is a whole process that happens for a lot of people around taking medications that I really wanted to normalize today. Just put it out there. This is a thing. So if you're somebody who's considering medications and you're feeling that that defeat or shame or embarrassment or whatever, your constellation of feelings are around it, other people feel that too. And that's okay. You can work through that and come to a decision that works for you. And again, as I stated at the top, there's going to be people on all sides of this that, yes, medication, no problem, let's do that. And other people who, I'm not going to touch that with a 10-foot pole. And that's fine. Those are your relationship to medication is what it is. And the truth is that from my end, what I see is how much benefit people get when they're in that moderate to severe range of symptoms and all the things that they've been trying aren't quite cutting it. Medication can really help. Anyways, thanks for being with me today. I'm glad you were able to join in. I'm really interested to know if there's anything you guys would like to hear about what happens in therapy. So please do email us at hello@momandmind and write in there podcast ideas, podcast topics, and let us know what you'd like to hear about. Experiences that you've had in therapy that you'd like for me to talk about in behind the sessions, or other topics that you're interested in hearing. We'd love to hear from you. Please make sure you have followed or subscribed to this podcast. Follow me on social media at Mom in Mind. And I thank you so much for being with me. Until next time.